Now, Deirdre Boyd, according to what, if I understood what Mr. Borden said correctly, the 800,000 12 to 17-year-olds who sold drugs in the USA, now that's 800,000 in 2005, are they being encouraged by the laws that are there to do so?
I think they're being encouraged by people who think it's acceptable, by people who want to legalize, by a society which takes it as the norm and which is a council of despair because they are not giving people enough credit for being able to take responsibility when they are given the correct information, when they're given enough choices, when they know about recovery options. And, you know, the risk-taking certainly is a part of it for the first experimental use, but if somebody has the biochemistry, the neurochemistry to become addicted, it's not about risk-taking, it's about they don't have an option until they know that recovery exists and that they can get into it. I mean, the definition of addiction or dependence is a dysregulation of the mesolimbic dopamine system. It is a medical matter. I mean, you're not, you know, saying that people ought to be, they should be treated like somebody with diabetes or other chronic disorders and given medical help and appropriate education. It's an all-round package. It's not just one thing. And, you know, to say it's all about supply reduction is being a very father figure. It's been too authoritative. It's only part of the solution. Everyone needs to be involved, and particularly communities. Communities can be so effective, but people need family values and other values so that they know they will be supported throughout treatment. And in one sense, users should not be stigmatized. I'm not talking about criminalizing people. I'm talking about a certain behavior. And if people don't commit that behavior, obviously they're not criminals or suffer any other effects, just as if, you know, if somebody wants to burgle a house, there are no other effects. This is a health problem, and it should be addressed as a health problem.
I completely agree this is a health problem, and therefore it should not be addressed by arresting people, putting people in prison, breaking down doors to see if there are drugs there. We don't arrest people for having diabetes, for engaging in the behaviors that can lead to diabetes or worsen its effects, or for doing poorly with the treatments for diabetes. We don't bring in police at all. It's outside of the equation. For most aspects of drug issues, police should also be outside of the equation also. But criminals also should be outside of the equation. We don't send people with diabetes to the street to find their needles or their insulin, if I haven't mixed my diseases up. And we shouldn't be doing that for substance abuse. Ours is, in fact, the Council of Hope. We believe, we know that there is a better way of managing drugs that does not create crime, that does not create global instability, and that does not have their users overdosing on the street.
Now, Mr. Borden, are you suggesting that the Drug Enforcement Agency is a waste of money, that it doesn't really achieve any results that are socially useful? And are you seriously suggesting that now that the criminals have got their hands on the drug trade, that if it was decriminalized tomorrow, they would stop, that they would give it up, they'd throw their hands up and say, well, now it's no longer illegal, we're going to hand it over to a reputable businessman, or they're just going to carry on peddling their drugs?
Well, who would buy the drugs from them when they can go to a safe and legal outlet to buy the drugs at a fraction of the price?
Oh, they drop their prices, surely.
Is how I see it. There will be fewer jobs in crime. At a certain point, the prices would go. You know, there is very little tobacco-related crime, and the crime that we have is from borders where there are different tax rates on different sides of the border. It's not a fundamental part of the cigarette trade. It's not a fundamental part of the alcohol trade. So we expect it will be the same for the drugs that are illegal now. There has to be a certain amount of profitability in crime to make it worth it to people to engage in the substantial amount of risk that goes along with being in crime. But to address your first question, is the Drug Enforcement Administration accomplishing a social good? Well, we've looked at at a recent hearing, and we've looked at this also. Senator Jim Webb noted that the average street price of cocaine here in the United States is about a fifth of what it was in 1980 when adjusting for inflation and purity. The objective of the prohibition policy or the strategy is to raise the price in order to reduce the demand. And so when the price decreases by 80%, though still much greater than a regulated market would make it, it's obviously not working.
Mr. Borden, I have to stop you there.
No, I don't think the DEA's efforts have been successful.
Thank you.
And the same goes for our drug war in the Andes, our drug war in Afghanistan.
Thank you. Deirdre Boyd, last word to you. Do you think that drugs are going to become a bigger problem going forward, or are we winning the battle?
It would be nice to think that they wouldn't be, but I would just like to end on one final note, which was your question about what would the criminals do if they weren't selling and distributing drugs, and informed opinion is that they will move on to people trafficking.
Thank you, Deirdre Boyd. I have to stop you there, and that was Four Corners. I'd like to thank my guests for expanding our horizons on the various issues related to drugs, their trafficking, and their consumption, and of course, you for watching. If you've missed any part of the program or would like to watch again, you can do so by logging onto our website, www.presstv.com/programs. And that familiar email address for your correspondence should be appearing on your screens now. Four Corners returns tomorrow. Until then, I've been your host, Jihad Mossavat in Tehran. From all of us on the team, goodbye.